Hello students, this is the presentation on ABG analysis. This is like most of the students think this is a very difficult topic, and you don't do ABG interpretation on med surg floors unless there is an emergency and some things need to be done. Otherwise, ABG interpretation is usually done in a high acuity floor such as ICU. Um, there are various YouTube lectures, and there are various ways people have tried explaining how to interpret ABG. My purpose right now is to give you an understanding of the very basics of this ABG. So you have some foundation in this, and because as this lecture is about homeostasis, ABG has a good role in establishing homeostasis in our body. Um, it is not difficult, it can be understood in simple basic terms, and you have to understand the pathophysiology when there is an acid base imbalance happening in the body. And the common terminology which I'll be using in this presentation is pH, uh, HCO3, PaO2, PaCO2, lungs, and kidneys. So these are the frequent terms. Let's go to the next slide. And why you care to know about the ABG as a nursing student? I already said that has a great role in playing in establishing homeostasis within our body, and if there is a disturbance in the acid-base balance in our body, then results can be fatal if not managed on time. Uh, Arterial blood gas, in a simple terms, uh, in our nursing world, means a blood test done by drawing blood from an artery, and usually radial. And who can do it? Of course, the RN can do it, respiratory therapist can do it, and phlebotomist or a doctor can do it. We will be talking a lot about partial pressure of some gases inside the arterial blood. And I just wanted to give you a simple understanding of what is a partial pressure of a gas. A partial pressure of a gas is a force which a certain individual gas exerts in a container, or it is a measure of the concentration of a gas in a mixture of gases. And this pressure is being caused by the impact of moving molecules against a surface. So let's go to the next slide. I just pulled this picture from the Google Images, and how it works and how the gases are exerting force. You can see it from this image, and there are three canisters. So the left panel of this figure shows a canister of oxygen. The middle panel shows a canister of nitrogen, and the right panel shows a canister containing a mixture of oxygen and nitrogen. And then you see a pressure gauge. A pressure gauge on each container shows the pressure exerted by the gas in that container. So the pressure of the gas is measured in millimeter of mercury or kilopascals. For our purpose, we'll stick to millimeters of mercury. Now our body fluids and tissues also have gases, and all these gases, they exert pressure, such as our lungs alveolar walls, they have pressure of some gases. The blood flowing through arteries is exerting some pressure on the arterial wall, and then trying to maintain acid and base balance in body. So that's why I want you to know that what is the partial pressure of gas. And because you have to relate this concept with the partial pressure of some gases within your body, maybe it's in alveolar walls or it's within the arteries. Let's go to the next slide. Objectives. Now I just did like kind of overview of the ABG, and in the following slides my main goal is to review the acid base, tell you exactly what does acid and what does base means for our body, and then what are the signs and symptoms of respiratory acidosis and alkalosis, and also signs and symptoms of metabolic acidosis and alkalosis. In the end, you will also understand how to interpret ABG. Um, in my then my YouTube lectures, there is also a PowerPoint titled "What is behind ABG analysis," and it will give you a better understanding of pH. And I did mention in class also that if you can go and take a look at this PowerPoint. For somebody who has no understanding of pH, to start with, you can view that lecture if you want. Before we proceed further, there is a very important thing I want you to know is that you have to memorize these numbers. And PO2 is partial pressure of oxygen. PCO2 is partial pressure of carbon dioxide. pH is telling you the hydrogen ion concentration in any liquid or gas. So right now we are concerned with the pH of our blood. Then you have HCO3, which is bicarbonate. You have to memorize this number that PO2 is 80 to 90 millimeters of mercury. Then PCO2 is 35 to 45, pH is 7.35 to 7.45, and bicarbonate is from 22 to 26. So let's go to the next slide because these numbers are very important in ABG interpretation. So this is something which, you cannot do anything. You have to memorize these. Now let's go to the next slide. Now, anytime you see the word, you hear, or somebody tells you the word pH, you relate pH with acid, and you relate bicarbonate with base or alkaline concept. So pH with acid and bicarbonate with base. So if there is a liquid or gas or anything, and if it's being termed acid, what makes that gas or liquid acid? It's hydrogen ion concentration. And what makes any liquid or gas base? That is bicarbonate ion, which is HCO3. The more the numbers of pH decreases, it goes down. The more the number of pH goes down, the more acidic a solution is. So if I think lime has a pH of, I don't know what, 2 or 3, or it has a very low pH, like 1 or something. You can look at the pH table and see what is the pH of lime. So lime has the lowest pH, so it means it's highly acidic. But in our body, it's not acidic because when it gets mixed with our gastric juices, it becomes alkaline. So the more the pH number decreases, the more acidic a solution is. This is the simple thing you need to remember. Now, suppose in a liquid, if there are more pH, and you put this liquid inside a body, or anything like a solution or a body, anything, what happens to that solution or body? That solution or body will become more acidotic. If there is a liquid and you put a lot of base in it, or maybe bicarbonate in it, that liquid or that body or that substance will become more alkalotic or basic. Okay. Now, suppose if I want to, uh, there is a solution and I want to make it less acidic, I can increase the base in it. Maybe I can put more bicarbonate in it. And suppose there is a solution which is very basic, which has a lot of bicarbonate. Maybe I can remove bicarbonate and put a little bit of pH in it to make it a little bit more acidotic. So acid is related with pH. Base or alkaline concept for our purpose here is related with bicarbonate, which is HCO3. There are two organs which are involved in acid-base balance, and that is lungs and kidneys. And in the following slides, we will see how one organ is helping another organ to maintain the proper acid-base environment in our body. Now, when lungs is helping to correct the acid-base imbalance, it will do it faster than kidneys. So just remember it. When lungs will correct the problem, it will do it in a faster pace than kidneys. So let's go to the next slide. Now, I am going to give you just the concept of respiratory acidosis and respiratory alkalosis, just an intro, and then I will explain you in detail what the acidosis signs and symptoms and causes are, and what the respiratory alkalosis causes and signs and symptoms are. Now, anything with respiratory is to do with lungs problems. So if I'm saying respiratory acidosis and respiratory alkalosis, you just remember this, it has something to do with lungs problem. So in both respiratory acidosis and alkalosis, the highlighted structures are lungs. And in the main key players inside the lungs is carbon dioxide. Now, carbon dioxide, is it an acid or a base? It's an acid. So always think of carbon dioxide as an acid, because the major lung chemical is carbon dioxide, an acid. On the other hand, the major kidney chemical is bicarbonate, which is HCO3 and hydrogen. So the major lung chemical is carbon dioxide, and the major kidney chemicals are bicarbonate and hydrogen ion. Okay. Now, kidneys are slow to compensate, and I said, but when they do a good job. Kidneys cannot blow off carbon dioxide. Lungs can blow off carbon dioxide. So the structure which can blow off carbon dioxide is lungs. It's not kidneys, just remember that. So when there is a lot of carbon dioxide buildup in the body, the client or the patient will become acidotic. So when body has lot of carbon dioxide, the patient carbon dioxide buildup, then the patient is becoming acidotic. Okay, now if carbon dioxide is retained in the body, it's built up in the body, which organs are not working correctly? Remember, carbon dioxide can only be excreted by the lungs. So if carbon dioxide is building in the body, then the lungs are not doing their job of excreting the carbon dioxide. So if a client is in or a patient is in respiratory acidosis or alkalosis, the problem is with lungs. Okay, because respiratory equals lungs. So that's a gentle, simple overview. Respiratory equal lungs. Okay, so in this slide we learned the concept of that anything to do with respiratory is to do with lungs. The highlighted structure for respiratories are lungs, and main key player for lungs is carbon dioxide. Carbon dioxide is acid, and if carbon dioxide is retained too much in the body, which organs are not working correctly? It's lungs, because they're not excreting that carbon dioxide so that a balance can happen in the body, and the body is less acidotic, so they're not doing their job. So the respiratory equals lungs. Let's go to the next slide. In respiratory acidosis or in respiratory alkalosis, lungs are sick. So that's why we call it respiratory. Major cause will be something related to carbon dioxide. And I'm repeating the same thing. There is an imbalance here with respiratory structures called lungs, and to correct it or compensate for it, kidneys will come to action. So anytime the lungs are sick and they are causing respiratory acidosis or respiratory alkalosis, the problem is due to carbon dioxide. And to correct this respiratory imbalance, the compensating organs will be the kidneys, because lungs are unable to compensate for themselves because they are sick. Now, when the lungs are sick, the kidneys will compensate. They will, the job which lungs cannot do, the kidneys will do, and they will compensate by manipulating the chemicals, two chemicals which it has, which is bicarbonate and hydrogen, to correct the imbalance and bring the pH back into normal range. And they will start secreting bicarbonate and excreting hydrogen. So remember, the lungs are sick, they cannot compensate for themselves. Kidneys have come into action, and they will manipulate the chemicals bicarbonate. Remember, bicarbonate is basic, and hydrogen is related with acidity, acidic concept. So to bring back the pH back to normal, they will secrete bicarbonate. So they will secrete more basic, and they will excrete hydrogen. So they don't want body to have more acidic content, because they also have this chemical hydrogen, which makes the body more acidic. So they will let their hydrogen go, and they will start secreting more of their bicarbonate to compensate for too much of acidity caused by the sick lungs. Now, kidneys are slow. They will not do it faster as if the lungs would have done it. The kidneys are slow, but they are very effective in compensating for respiratory acidosis or alkalosis. So, the kidney's goal when it is compensating would be to get the pH back into normal range. If the lungs, they are getting getting rid of too much carbon dioxide, then the patient can become alkalotic. So in the beginning I said, if the body has a lot buildup of carbon dioxide, and the body is becoming acidotic. At the same time, if the lungs are getting rid of too much of carbon dioxide, which is an acid, as with hyperventilation, then the patient will become alkalotic. So just so you remember. Okay, so let's go to the next slide. Now, metabolic acidosis and metabolic alkalosis. Anything with metabolic is to do with kidneys. So, in both metabolic alkalosis and metabolic uh, acidosis, I think I wrote the alkalosis again. So, in both metabolic alkalosis and metabolic acidosis, the highlighted structures are kidneys. Kidneys are sick, so that's why we call it metabolic. And main key players in metabolic problems are those kidneys chemicals, which are bicarbonate and hydrogen. Let's go to the next slide. As kidneys are sick and they cannot maintain blood pH, lungs now will come into action and they will be known as compensating organs. And lungs have one important player, carbon dioxide, which will start doing its work. Now, lungs can either blow off or they can retain carbon dioxide as soon as possible to correct the metabolic acidosis or alkalosis. Now, retaining and excreting carbon dioxide will happen due to increasing or decreasing respiration. The only way carbon dioxide can build up in the blood is by a significant decrease in respiration. If breathing slows down, then the acid, which is the carbon dioxide here, is not exhaled effectively and it builds up in the blood, causing acidosis. So I'm going to say again in what I'm going to repeat again what I explained in this slide. As kidneys are sick and they cannot maintain blood pH, lungs or the compensating organs will help here. Lungs have one important key player, carbon dioxide, which will come into action here. Lungs can either blow off or retain carbon dioxide as soon as possible to correct the metabolic acidosis or alkalosis. How this will happen? Retaining and excreting carbon dioxide will happen due to increasing or decreasing respirations. The only way carbon dioxide can build up in the blood is by a significant decrease in respiration. So, decrease like going down. If breathing slows down, then the acid, which is the carbon dioxide here, is not exhaled effectively and it builds up in the blood, and thus the patient becomes acidotic. Now, let's go to the next slide. Now we're going to learn about respiratory acidosis in detail. So first of all, respiratory acidosis, you need to know the numbers. Here the blood pH level is below 7.35. Partial pressure of carbon dioxide in blood which is known as PCO2, is more than 45 millimeters of mercury. Carbon dioxide retention is happening and patient is hypoventilating and pH is going down. Remember, low pH numbers is high acid. Partial pressure of oxygen is less than 80 millimeters of mercury, and when carbon dioxide is up, oxygen is down. I would like you to go into the acid-base imbalance in your book and look up the definition of hypercapnia. Respiratory acidosis can be acute for a shorter time, like due to sudden stop of breathing, or it can be chronic due to some lung diseases. So, respiratory acidosis is an acid-base imbalance that occurs when the pH is decreased below 7.35 and the partial pressure of carbon dioxide is increased, which is greater than 45 millimeters of mercury. Now, anytime you see the words partial pressure here, you have to know that we are talking here about arterial blood. Carbon dioxide builds up in the blood because the client has some disorders which causes the client to hypoventilate and retain carbon dioxide. Since the client retains this acid, this causes the pH to go down. This imbalance can be acute, as in sudden stop of breathing, or chronic, such as in lung diseases. So look up the hypercapnia definition. I don't think it's that difficult, but what I have in my notes is it's a buildup of carbon dioxide in the blood to levels greater than 45 millimeters of mercury. Okay, let's go to the next slide. I just did a little break in your slide topic. We were discussing respiratory acidosis, and I just because brain is a very important organ to be getting affected by the imbalance in the pH. Brain does not like body's pH to be in imbalance. So what will happen to patient's neurostatus, his LOC? This is very important part of nursing assessment. Brain likes the body's pH to be perfect all the time. When the pH is out of its normal range, then patients changes in patients' neurostatus, especially as in level of consciousness can happen. So this is why with any acid-base imbalance, you must monitor the patient's level of consciousness. Let's go to the next slide. Now we have um, respiratory acidosis causes. What are some of the simple causes for respiratory acidosis? Simple one is respiratory arrest. When a patient is having respiratory arrest, at that time the patient is not exhaling carbon dioxide. So that's why his body is going through the respiratory acidosis. There are some drugs, narcotics, sedatives. Remember uh, why we give so much importance to monitoring of patients' respiration and all that when you have to give these high level narcotics and sedatives, anesthesia, because in these cases, um, all these things they are suppressing respirations. All these drugs they are suppressing respirations and they are causing retention of carbon dioxide, and the body's acidotic uh, you know, um, status will increase. So that's why, respiratory acidosis can happen due to some drugs. Even in the sleep apnea, the respirations are being suppressed and there's retention of carbon dioxide. Even in excessive alcohol, there is respirations are suppressed and there is retention of carbon dioxide. Now, when you have surgical incisions, especially when they have uh, surgery with done on the abdominal wall, or there were some broken ribs, there's a lot of pain happening, and when there is pain happening, then with deep breathing there is a lot of pain, and this pain with deep breathing is causing retention of carbon dioxide, and that is why there is a respiratory acidosis condition happening. um, Collapsed lung, we talked about it a little bit in respiratory, pneumothorax and hemothorax. In the collapsed lung, lungs are unable to blow off excess carbon dioxide, and that's why it's causing a buildup of carbon dioxide in the blood. Weak respiratory muscles, as in the diseases myasthenia gravis and Guillain-Barré syndrome. You're not supposed to know what is Guillain-Barré syndrome, myasthenia gravis for this purpose, but need to know that in myasthenia gravis and Guillain-Barré syndrome, there are weak respiratory muscles and it can be a cause of respiratory acidosis. Airway obstruction, poor cough mechanism, laryngeal spasm, anything which is stopping you from, uh, mm, stopping you from exhaling the carbon dioxide and leading to buildup of carbon dioxide. Brain trauma, especially if specifically if it is happening in the structure called medulla, and if there is a brain medulla involved, then it is leading to decreased respiratory state. High flow oxygen in chronic lung disease. Decrease. Now, I think I have talked about this in the class about the oxygen, high flow oxygen in chronic lung disease and such as in COPD, because here the client's drive to breathe, his drive to breathe is hypoxia. So when a patient has a chronic lung problem, her drive to breathe will no longer be, uh, you know, uh, hypercapnia, but will be hypoxia. As long as the client is hypoxic, he will or she will breathe spontaneously. If a lot of oxygen is administered to the COPD patient, the patient is not hypoxic anymore, and that stops that patient from breathing. So, with COPD patients, high flow oxygen will lead to respiratory acidosis condition. And then when somebody has severe respiratory distress syndrome, uh, then there is a decreased blood flow going to the lungs and decreased gas exchange happening, and it is leading to carbon dioxide retention. So these are some of the causes which makes our body, which can make a body go into respiratory acidosis state. Now, in the next slide, let's look at uh, let's look at what are some of the simple signs and symptoms. And the first sign and symptoms you can very well see is based on neurological. So neurological changes, headache, confusion, blurred vision, lethargy, coma, decreased DTRs. Now, excess acid, it causes the brain vessels to vasodilate, leading to brain swelling and a lot of intracranial pressure. And carbon dioxide can cross the blood brain barrier, causing changes in pH. So, the excess acid in respiratory acidosis is causing brain vessels to vasodilate, and which leads to brain swelling, a lot of high intracranial pressure. Carbon dioxide at this time can cross the blood brain barrier and can cause changes in pH. Then there is something called papilledema, and it is due to increased intracranial pressure. There is something called um, hyperkalemia, and the acidosis causes the potassium to increase in the blood. And to compensate for the respiratory acidosis, the hydrogen moves out of the blood into the cell where potassium was living. And now the blood is less acid. However, potassium does not want to live with hydrogen inside the cell. So potassium moves into the bloodstream, causing the serum potassium to go up. So hyperkalemia is one of the signs and symptoms of respiratory acidosis. Decreased muscle tones and in decreased DTRs is also one of the signs and symptoms of respiratory acidosis. Then you have low BP, hypotension. With severe respiratory acidosis, you can see vasodilation. So that's why low BP. Increased carbon dioxide levels will lead to decreased oxygen levels. So whenever in the body there is high carbon dioxide, then it is leading the body to low oxygen level, and that's why patient will be restlessness, and there'll be restlessness, and patient can be tachycardic. As the patient can also show some changes in his heart rhythm, and this can be due to high potassium or low oxygen. As the acidosis worsens, the electricity in the heart slows and it causes bradycardia and cardiac arrest. So, if the acidosis keeps on going, the electrical activity of the heart will slow down and it can lead to low, slow heart rate and even cardiac arrest. Urine can become acidic, so kidneys are compensating because a lung problem, so kidneys are compensating and they're compensating by excreting hydrogen, and they will excrete hydrogen through the urine. A lot of vasodilation in blood vessels is happening, so warm, you can see the patient has warm skin. Now, patient has respiratory acidosis. He has all these signs and symptoms. Now, what you can do to help this patient? So, what you can do to help this patient, always treat the cause. You have to um, you have to see that what is that which is leading to buildup of so much of acid in the patient's body, and the goal will be always to have the patient blow off the excess carbon dioxide. We will give some drugs maybe to open up the airways and thin out the secretions so they can be coughed up. Increase fluids to liquefy secretions, which is not letting patients blow off the excess carbon dioxide because there is problem with patient breathing. Oxygen can help, breathing treatments can help, and we can elevate head of the bed for lung expansion. Okay, so let's go to the next slide. You monitor ABGs, of course. We will look at the arterial blood CAT tests. We can monitor for electrolyte imbalance, maybe due to some like potassium imbalance. Something is happening and body is becoming acidotic. We can look at patients' O2 sat. We can do some airway clearance, maybe by doing some intubation. And they can be mechanical ventilation with PEEP. You will know PEEP in detail in your advanced med-surg course. PEEP in simple terms stands for positive end expiratory pressure. It is a setting on mechanical ventilator. On end expiration, when the cycle of inspiration and in the cycle of inspiration and expiration, when there is towards the end of the expiration, the mechanical ventilator exerts pressure down into the lungs to keep the alveoli from collapsing, and therefore the gas exchange is improved. So mechanical ventilation is used when the patient's own ventilation is not working, and so mechanical ventilation will help in gas exchange and will help breathing. Anytime a patient is on PEEP, your primary nursing assessment is to listen for bilateral breath sounds. Why? Because the pressure exerted from the mechanical ventilator can pop a lung, and lung popping is bad. So this is like artificial. Man is putting pressure inside the lungs to inflate and help the patient breathe. So too much of pressure exerted from the ventilator, and if it is not being monitored, can pop a lung. Let's go to the next slide, respiratory alkalosis. Now, respiratory alkalosis, before I talk about it, I just want to look at the numbers, and it is the pH is greater than 7.45. Just notice how pH goes up with the alkalosis. PCO2 is less than 35 millimeter mercury because it is being exhaled. PO2 is greater than 100 millimeters of mercury. Bicarbonate is normal until kidney starts compensating, then it will be less than 22 MEQL per liter. So I think bicarbonate in 22 went into 2 bullets, but it's one sentence. So in the respiratory alkalosis, you see pH, you see PCO2, you see PO2, you see bicarbonate. Usually, the ABG interpretation, which I have discussed in the following slides, will take 3 things into consideration: pH, PCO2, and bicarbonate. But PO2 is also involved in this, so it's important to mention partial pressure of oxygen too. In our initial stages, we'll be only taking pH, pCO2, and bicarbonate levels to interpret ABG. Now, bicarbonate will be normal in respiratory alkalosis until kidney starts compensating, and when the kidney starts compensating, then it will be less than 22 milliequivalent per liter. Okay, so um, so carbon dioxide is less than 35, pH greater than 7.45. So when pH is increased, carbon dioxide is decreased. As in respiratory acidosis, the lungs are the cause of the primary problem. So it happens in respiratory alkalosis too. The lungs are lungs are the uh, cause of this problem. The only way the partial pressure of carbon dioxide can decrease in the blood is through excessive exhalation, so hyperventilation. So if the patient does excessive exhalation, then the buildup of carbon dioxide in the body, and thus the buildup of pressure of carbon dioxide in the body, can be decreased. Um, okay. And in simple terms, the respiratory alkalosis means that the client has lost excessive carbon dioxide, which is an acid, and that's why the patient is becoming alkalotic. Um, okay, so let's go to the next slide. These are some of the causes of respiratory alkalosis. So you have hysteria, anxiety. Now, hysteria and anxiety, and also high mechanical ventilator settings, these will all lead to rapid respirations. So when there are rapid respirations, a lot of carbon dioxide is being uh, exhaled, and then the body forgets that it needs to keep some carbon dioxide to maintain that pH balance, but it is taking out a lot of carbon dioxide, exhaling a lot of carbon dioxide. So rapid respirations happen both in hysteria, anxiety, high mechanical ventilator settings. Uh, Now you have aspirin overdose. Aspirin is that drug which stimulates the respiratory center, causing increased respiration. So I'm not just saying simple aspirin tablet when there is aspirin overdose. So aspirin stimulates the respiratory center, causing increased respirations. Pain, fever, sepsis, pain like having a baby, fever, sepsis. Here you are doing a lot of increased respirations. So here a lot of increased respirations are happening. So that's why the body is going through alkalosis. Less oxygen in high altitude, it causes increased respirations. Fewer blood cells, like in anemia, which is the job of the RBCs to carry oxygen, it causes hypoxia, and hypoxia causes increased respirations to produce, uh, you know, to produce a condition called respiratory alkalosis. So there are low red blood cells to carry oxygen, and causing hypoxia. Now, and the hypoxia causes increased respirations to produce more oxygen. So a lot of patient breathes faster, and he's exhaling more carbon dioxide. Now, signs and symptoms of respiratory alkalosis is hyperventilation, lightheadedness, dizziness, fainting, rapid pulse, hypokalemia, and arrhythmias. Hyperventilation, of course, because a lot of respiration is happening, increased respiration, you are losing, it is causing you to have excess loss of carbon dioxide. Lightheadedness, hypocapnia causes vasoconstriction of brain vessels, and therefore the blood flow to brain is decreased. So if there is less carbon dioxide, it causes vasoconstriction of brain vessels, and then there is a decrease in blood flow to the brain. Another sign and symptoms is rapid pulse, because low carbon dioxide triggers receptors in the brain structure called medulla, and that increases the heart rate. Low potassium In the low potassium, where it is that the hydrogen ions are moving out of the cell into the bloodstream to decrease the alkalinity. So the a body which was in a correct acid base imbalance, hydrogen ions moved out of the body cell into the bloodstream. And hydrogen ions is has to do with acidity, acidic concept. So hydrogen ions are moving out of the body cells and they're going into the bloodstream. When hydrogen ions goes into the bloodstream, where there was a balance between the acid and base, it decreases the alkaline atmosphere and it increases the acidic atmosphere. At that time, potassium moves into the cells trying to get away from hydrogen ion, which decreases the serum potassium. So that's why we have hypokalemia. Arrhythmias are because of hypokalemia. Let's go to the next slide. This is just a simple break, and this is just to let you think. Suppose you have a patient who's screaming, crying, and hysterical, as well as breathing quickly. After a while, this patient faints and he's lying on the floor. In this case, the body is going through respiratory alkalosis, and kidneys has started compensating. But kidneys, they take some time. So what you will do? Will you wait for the client to faint, or you can do something quickly to help this client? So you think about carbon dioxide. So I was just took a pause, a little bit of pause. So the there is respiratory alkalosis happening, and you see a patient who's screaming, crying, and hysterical, as well as breathing quickly. And this patient says, I think I'm going to faint, and he faints, and his conscience goes right there in front of you on the floor. But when he was saying, I'm going to faint, can you do something? Yes, you can do something. You can calm the patient. You can have him slow down his breathing. Have him breathe into a paper bag, not plastic. You don't want him to suffocate. So he can breathe into a paper bag. When the client exhales or when the patient exhales into the paper bag, he will re-inhale his own carbon dioxide. And that's where he will get his carbon dioxide, and he won't be able to, you can prevent him from fainting at that time. So in respiratory alkalosis, actually what's happening is we need some acidity, not acidity, acidotic state. We need some acidotic state, and the patient is saying, I'm fainting. And what you'll do, you calm the patient, tell him to slow down his breathing, and have him breathe into a paper bag. This is a very common NCLEX question. What you will tell the patient says, I'm screaming, fainting, and the ABG content, they really like asking about the paper bag. So have the patient breathe into a paper bag. So, and when you tell him to breathe into a paper bag, the patient is exhaling into the paper bag his carbon dioxide, and he will re-inhale his own carbon dioxide. So it's his carbon dioxide. So let him have it back. So okay, let's go to the next slide. So now we will go. So how we will help the patient who is going through respiratory alkalosis? We will correct the problem, we'll calm the patient, we'll monitor vital signs, especially respirations, electrolytes, and ABGs. We can give some anti-anxiety medications. We can put patient on mechanical ventilator to control his respiratory rate. Have client breathe into paper bag or rebreather mask to encourage carbon dioxide retention. So here we want a little bit of carbon dioxide retention. Life-threatening arrhythmias and seizures can also happen with respiratory alkalosis if not monitored. So Let's go to the next slide, metabolic acidosis. Now, metabolic acidosis, we want to know how the pH looks like. It's very important to know how the numbers look like. So pH is less than 7.35. PCO2 um, will decrease to less than 35 millimeters of mercury because as it is blown off. And then partial pressure of oxygen will be normal. Bicarbonate will be less than 22. Now, metabolic acidosis is an acid-base imbalance where the pH is less than 7.35 and the bicarbonate level is less than 22. Um, acid or hydrogen ions builds up in the body, or too much bicarbonate has been lost from the body. Basically, here the pH is being decreased and the bicarbonate level is also decreased. The less bicarbonate you have in the body, the more acidic you will be. In metabolic disorders, the problem is not with lungs. We know the problem is with kidneys. So if there is problem with kidneys, we will be concerned with two chemicals, bicarbonate and hydrogen. The, the decrease in the alkaline substances, bases will cause a buildup of acid in the body, causes acidosis. Which organ will compensate? The lungs will compensate by increasing respiration in an effort to blow off excess carbon dioxide and therefore increase pH. So metabolic acidosis, we know the problem is kidney, and the two major chemicals of kidneys are hydrogen ions and bicarbonate. So we'll discuss these two. And you need to know the numbers. Let's go to the next slide. Metabolic acidosis, and there are a lot of causes. Let's talk about the simple cause, as shock. You will be doing in detail a lecture on shock in your advanced med surg. But simply what happens in shock is that the oxygenated blood is not being delivered throughout the body. And the body thus starts having an anaerobic metabolism, and there is a buildup of lactic acid. And that's how when the metabolic acidosis is happening. So in shock, oxygenated blood is not delivered throughout the body. It causes anaerobic metabolism inside the body, and there is a buildup of lactic acid, thus causing metabolic acidosis. Now there can be certain kidney illness. Now decreased secretion or reabsorption of bicarbonate into the blood leads to decreased excretion of hydrogen ions, and thus the condition of metabolic acidosis happens. GI, so kidney illness and also GI illness or diarrhea. The lower GI contents are alkaline, and diarrhea causes a loss of base solutions from the body, resulting in acidic blood. So that's why you have metabolic acidosis. There are certain drugs as Diamox and Aldactone, and all these drugs, like Diamox, it causes loss of bicarbonate. Aldactone causes potassium retention and an increase of potassium in blood serum. So the blood pushes the potassium into the cell to decrease serum potassium. This is a normal compensatory mechanism. So when potassium is pushed into the cell, hydrogen ion is pushed out of the cell into the bloodstream, causing acidosis. So drugs Diamox and Aldactone, they both can be responsible for metabolic acidosis. There is a certain condition called diabetes ketoacidosis, and also there is a certain condition called malnutrition and starvation. All these, the body usually breaks down fat for energy, producing the acid ketones. And ketones are a byproduct of fat metabolism, and ketones are acids. So in all these three conditions, something is being produced which is known as ketones, and ketones are acids, and that's why how the body goes into the metabolic acidosis condition. There is a thing called lactic acidosis, and if you've done your prerequisites, you must have come across this word. Arterial disorders, they decrease oxygenated blood in the tissues. So if you have some disorders in the body which is due to arterial uh, damage, this causes the body to switch from aerobic metabolism, which is using the oxygen, to anaerobic metabolism without oxygen. And the end product of anaerobic metabolism is a buildup of lactic acid, which leads to acidosis and also to the occlusion of some lower extremity arteries. So, lactic acidosis is also responsible for metabolic acidosis. Signs and symptoms. The signs and symptoms of um, metabolic acidosis are not as extensive, but um, kind of similar to what we learned earlier. Arrhythmias will happen because there can be bradycardia, slow heart rate. So can be peak T waves, high T waves. I don't want you to remember high T waves, but just happening arrhythmias such as bradycardia can happen. Then they can be headache, decreased LOC, coma, and I told you earlier the brain does not like it when the pH is out of normal range. I think I wrote headache, decreased coma, and LOC 2 times, so just ignore it. Then you have hyperkalemia. I have explained it many times how with hyperkalemia there is, uh, it's just one of the signs and symptoms where, when the body's acidotic state rises up, it leads to hyperkalemia. Now, muscle twitching and burning, numbness, weakness, oral numbness, weakness, flaccid, paralysis. These are all a sign and symptoms of very high potassium. So when there is high potassium in the body, these are some of the signs and symptoms. And the high potassium is happening because of the metabolic acidosis state. Weakness, flaccid paralysis, tingling, and numbness in the arms and legs. This is happening because body is having metabolic acidosis. Along with high potassium, even high calcium is also happening. So hyperkalemia and hypercalcemia is leading to weakness, flaccid paralysis, tingling and numbness in the arms and legs. And what you can do to help this patient, you can monitor ABGs, watch for seizures, and start seizure precaution protocol as brain doesn't like pH to be disturbed. Monitor LOC closely, and this is for metabolic acidosis. Monitor and manage both high potassium and arrhythmias as applicable to patient situation. Give IV lactated ringers to increase the base level. Give IV bicarbonate to decrease acidity, and don't forget to treating the cause. What is the main cause behind the body going through metabolic acidosis. Let's go to the next slide. Metabolic acidosis, metabolic alkalosis. Now I can see there's already 58 minutes of this presentation, and I want to take a break here, and on the second recording I will start with metabolic alkalosis. I don't want to go it beyond an hour, so I'll stop here and